In their 70s and beyond, many people believe that the more checkups they get and the more tests they take, the safer they'll be. But the truth is far less comforting. Some health screenings that seem harmless can actually spread anxiety and even push seniors toward dangerous complications. Did you know that a few common tests may increase the risk of surgery, damage the liver and kidneys, or even trigger cancer? This video reveals 5 routine screenings that, after age 70, you should think twice about. Because sometimes, more testing doesn't mean better health. Let's uncover the truth that few dare to talk about. Bone density test, DEXA scan. After turning 70, being diagnosed with weak bones seems almost unavoidable. A printed report filled with numbers can suddenly become a source of fear, pushing many seniors to accept lifelong medication in the hope of preserving strong legs and a straight back. But as the saying goes, not every supplement is truly beneficial, and some medicines may bring more harm than help. In fact, many osteoporosis drugs have been linked to serious side effects. Some patients develop stomach pain and indigestion after a period of use, while others suffer jaw pain or even such severe jaw damage that they can't chew a simple spoonful of soft rice. There's an old saying, good health is the real treasure of the family. Health itself is our most valuable asset. That's why instead of depending too much on numbers from a scan, it's more important to listen to your own body. If someone can still walk to the market in the morning, stroll around the yard with ease, and has never experienced a fall or fracture, then the fear of osteoporosis may simply be an exaggerated shadow of aging. From this perspective, I believe the real, long-term solution doesn't lie in chemical pills, but in daily lifestyle habits. With health, you have everything. Without health, you have nothing. Strengthening bones naturally can start with morning sunlight for vitamin D, calcium-rich foods like small fish eaten with bones, yogurt, or leafy greens. Gentle activities such as walking, breathing exercises, yoga, or gardening allow the body to move naturally, improve balance, and reduce the risk of falls. These small, consistent actions often bring far better results than expensive pills that come with hidden dangers. Another proverb says, health comes from care, not from medicine. True strength doesn't come from one single prescription, but from steady, everyday care. Nutritious meals, deep sleep, and fresh morning air all contribute to stronger, more flexible bones. The greatest gift in old age is not a test result on paper, it's the joy of walking steadily with a smile, and the happiness of gathering with family without suffering from drug side effects. The lesson is clear. Machines can only provide one perspective, but your body is the most honest voice. If your steps are still steady and your spirit is at peace, place your trust in your inner vitality. Remember, prevention doesn't mean unnecessary medication. Prevention means living moderately, keeping the mind calm and the body flexible. That way, aging is no longer a burden, but a peaceful and fulfilling journey. Still, always consider carefully and only proceed with tests or treatments if they are truly necessary. Cardiac stress test. Putting a 75-year-old on a treadmill for a cardiac stress test may sound modern, but in reality it can bring more risks than benefits. For seniors, the accuracy of this test is questionable. The false alarm rate can be as high as 40%, according to a study published in JAMA Cardiology. In other words, out of every 10 elderly patients tested, 4 may be misdiagnosed. This often leads to a cascade of invasive procedures such as cardiac catheterization, stent placement, or even coronary bypass surgery without any real improvement in health or lifespan. After such interventions, older adults face not only the dangers of surgery but also complications like kidney failure from contrast dye, internal bleeding, or prolonged hospital stays. There's a saying, prevention is better than cure, but prevention doesn't mean testing recklessly and turning yourself into a paper patient. A 75-year-old heart beats slower and tolerates less exertion. That's simply the natural course of life. Unless there are serious symptoms such as chest pain with short walks, significant shortness of breath climbing stairs, or unusual fatigue even at rest, forcing the body through treadmill tests is unnecessary. A simple resting ECG is safer, carries far less risk, and still detects abnormal rhythms. Another less invasive option is a coronary calcium scan, which can reveal dangerous plaque buildup without the hazards of complex procedures. One real case in the US involved a 76-year-old man who still walked daily around his neighborhood, occasionally feeling tired only on steep hills. After undergoing a stress test, his results were inconclusive, leading doctors to perform an angiogram and place a stent. Unfortunately, that very evening he suffered a severe reaction to the contrast dye, developed acute kidney failure, and was hospitalized for over a week. The final findings showed no significant blockage. The stent was unnecessary. This case is far from unique. Large studies involving thousands of older patients have reported similar outcomes. As the proverb goes, health is gold, wisdom is silver. But protecting health requires knowing what to accept and what to avoid. Older adults need attentive listening more than endless rounds of testing. A balanced diet rich in vegetables and fish, breathing exercises, light walks, and adequate sleep are the safest prescriptions for the heart. Maintaining a healthy weight, reducing stress, and sticking to low-risk checkups prevent heart disease far more effectively than chasing high-tech but complication-prone tests. The lesson is clear: more testing is not always better. Seniors need safety, stability, and peace in every step and every breath. Instead of enduring the physical and emotional strain of unnecessary exams, let the heart be cared for through healthy living and mindful self-awareness. That is how aging becomes not a burden, but a time of health, peace, and meaning. And of course, always consult your doctor carefully before agreeing to this test. Brain MRI for forgetfulness. A little forgetfulness in your 70s is usually nothing to worry about. It's a normal sign of natural brain aging, no different from graying hair or wrinkled skin over time. Yet when an older adult hears medical terms from an MRI scan like brain atrophy, white matter spots, or degeneration, fear often takes over. Many immediately think they have Alzheimer's disease or are sliding into dementia. That fear can cast a heavy shadow over an otherwise normal life. In fact, statistics published in Neurology show that 86% of MRI findings in people aged 70 to 85 simply reflect natural changes, while only about 3% truly point to a condition that requires treatment. That means nearly 9 out of 10 patients walk away with unnecessary worry. As the old saying goes, illness often begins in the mind. Many seniors lose sleep, abandon daily routines, and live in constant anxiety after seeing unfamiliar words on a scan. Take the example of a 74-year-old man in the US. He used to occasionally misplace his keys, but after an MRI report mentioned abnormalities, he convinced himself he was becoming senile. He gave up driving, withdrew from social activities, and his stress actually worsened his memory. Later, when tested with a basic memory exam, his cognitive function turned out to be completely normal. In my view, brain MRI is only truly necessary when severe symptoms appear, such as sudden seizures, drastic personality changes, or short-term loss of basic daily functions. For mild forgetfulness like failing to recall an old friend's name or misplacing small items, simple cognitive tests such as the MMSE or MoCA are far more appropriate. They are quick, inexpensive, and avoid unnecessary psychological stress. Instead of sending seniors into intimidating machines, we should encourage them to stay active, get enough sleep, and exercise their minds through reading, chess, or even learning a new song. With health, you have everything. Without it, you lose it all. But health is not just in the body, it's also in the mind. A calm spirit, free from needless fear, is the brain's greatest medicine. Research shows that older adults who maintain healthy routines, eat well, and engage in memory exercises have up to a 30% lower risk of dementia compared to those who don't. That number reminds us that optimism, laughter, and a few games with friends may be more valuable than an anxiety-filled MRI. The lesson is clear: be cautious before jumping into expensive tests that often bring more fear than answers. As another saying goes, peace of mind brings clarity of thought. At age 70 and beyond, mental sharpness doesn't come from machines, it comes from how we cherish and care for our daily lives. That is the true key to aging with health, joy, and meaning. Still, it's worth thinking carefully before deciding on this kind of exam. Routine colonoscopy. Many people over 70 believe that getting regular colonoscopies is the ultimate safeguard against cancer, like a protective charm. But the truth is far more complicated. Colonoscopy is an invasive procedure, and in later years it carries significant risks that are often overlooked. According to a study published in JAMA Internal Medicine, out of 1,000 patients aged 75 and older who underwent colonoscopy, only 2 lives were truly saved through early detection, while more than 20 suffered serious complications such as perforated intestines, severe bleeding, or heart rhythm problems caused by anesthesia. That means the risk outweighed the benefit by nearly tenfold, a sobering figure that demands careful thought before rushing into the procedure. As the old saying goes, bitter medicine cures illness, but the truth can be hard to swallow. For many, it's shocking to hear that more colonoscopies don't always mean better outcomes. The aging body is less able to withstand the stress of such interventions. The bowel prep alone, with high doses of laxatives, can cause dehydration, low blood pressure, dizziness, and increase the risk of falls. Meanwhile, anesthesia used during the exam can temporarily disrupt memory, leaving seniors already vulnerable in cognition feeling even more unsettled. A far safer alternative is the annual stool test, known as the FIT, fecal immunochemical test. This simple, non-invasive, low-cost method can detect hidden blood in the stool, one of the earliest warning signs of colon cancer. A report from the World Health Organization notes that FIT has up to 79% sensitivity in detecting significant lesions. While not perfect, its safety and convenience make it a much more reasonable choice, especially for people over 70. As the proverb says, prevention is better than cure. In this case, prevention doesn't mean undergoing heavy-handed procedures, but rather choosing smart, body-appropriate methods. Seniors should reserve colonoscopy for cases with clear warning signs: blood in the stool, long-term changes in bowel habits, unexplained abdominal pain, or a family history of colon cancer. Only then does colonoscopy truly serve its purpose as a diagnostic and timely intervention. Otherwise, forcing a frail body into routine colonoscopies can end up being more harm than good. One striking example comes from the US, where a 73-year-old woman who had no symptoms agreed to a colonoscopy on the advice of a young doctor. After the procedure, she suffered a perforated intestine, spent nearly 2 weeks in the hospital, and lost the joy of helping her children and grandchildren. If she had chosen the FIT test instead, she likely would have avoided such a devastating complication. The lesson is clear: older adults must be wise in choosing health checks. Colonoscopy is not inherently bad, but it should never be done indiscriminately. The most precious gift in old age is peace of mind, the joy of stepping outside to watch the clouds, and the warmth of sharing moments with loved ones. To preserve those treasures, we need gentler, safer preventive methods. After all, health is gold, and peace of mind is a jewel. Only when both are protected does old age truly become a serene autumn of life. And yes, always consult your doctor carefully before deciding on this exam. Full body CT scan. At first glance, a full body CT scan sounds appealing. It's often advertised as a way to screen from the root and protect overall health. But behind its modern image lies a hidden trap that can turn healthy people into patients. According to the American College of Radiology, a single full-body CT scan can expose you to about 500 times more radiation than a standard chest X-ray. Repeated exposure at this level doesn't necessarily detect disease earlier, but it does raise the risk of developing cancer. A 2023 study in JAMA Internal Medicine estimated that overuse of CT scans may account for up to 5% of all new cancer cases in the US each year, a staggering figure. As the old saying goes, too much of a good thing becomes harmful. What seems beneficial when overused can become a burden on the body. For older adults already physically fragile, the radiation dose is like an invisible blade slowly cutting into health. Even more concerning, full-body CT scans often reveal tiny nodules or benign abnormalities that nearly everyone over 70 or 80 has. But once such findings appear on a scan, they ignite fear. Patients get swept into a cycle of follow-up tests, biopsies, and even unnecessary surgeries. One case involved an 80-year-old man in otherwise excellent health. A CT scan revealed a small lung nodule, and he underwent a biopsy. The results showed it was harmless, but the procedure collapsed his lung, leaving him hospitalized for over 2 months. He became a patient because of a test he never truly needed. The saying, "Prevention is better than cure," still holds true. But prevention doesn't mean taking every test suggested. It means choosing wisely, listening to your body, and undergoing only evidence-based exams. Full-body CT scans are not a smart choice for people without specific symptoms. Only when there are clear warning signs such as coughing up blood, unexplained weight loss, or persistent pain does a targeted CT scan on the suspected organ become truly useful for diagnosis. Instead of chasing flashy health packages, what older adults need most is a balanced lifestyle. Nutritious food, gentle exercise, a positive outlook, and regular checkups with a trusted doctor prevent illness far more effectively than a risky CT scan. With health, you have everything, and that health doesn't come from overscanning, but from harmony between body and mind. The lesson is clear. Be cautious about routine full-body CT scans. Without symptoms, don't turn yourself into a patient unnecessarily. Only by choosing the right tests at the right time can we truly protect life's most precious asset, our health. And that, perhaps, is the most meaningful lesson of all. The important lesson, the key takeaway from all these stories is simple. Don't let invisible fears push you into unnecessary tests. At any age, but especially after 70, every medical procedure is a double-edged sword. It may offer benefits, but it also carries the risk of complications. Seniors must understand that good health doesn't come from doing as many tests as possible, but from choosing the right test, at the right time, for the right reason. Before agreeing to any procedure, ask your doctor. If the result is abnormal, what happens next? Do the benefits outweigh the risks? By asking questions, you take an active role in protecting yourself. There's an old saying, know yourself and know the situation, and you'll win every battle. The same applies to medicine. When we truly understand our own condition and carefully weigh the pros and cons before saying yes to a test, we avoid wrong decisions. Living with awareness, clarity, and wisdom is the real key to lasting health, so that old age can truly be a time of peace and fulfillment. This final reflection reminds us, the most valuable lesson is not about fearing disease, but about living wisely. With thoughtful choices, we can keep our golden years not only healthy, but also meaningful and serene. Final reflection: not every medical test brings real benefits. Modern medicine is advanced, but that doesn't always mean it is completely safe. After age 70, the body has already gone through many changes, so every decision about testing must be weighed carefully. Ask yourself, what is the true purpose of this test? If something abnormal is found, will the next step be truly necessary, or will it only bring more anxiety and expose me to unnecessary risks? As the old saying goes, contentment brings peace, and knowing when to stop brings happiness. The same applies to healthcare. Sometimes fewer tests, chosen wisely, are far more effective than spreading ourselves thin. What truly matters is prevention at the root. Eating nutritious foods, maintaining a balanced lifestyle, getting deep sleep, moving the body gently every day, nurturing an optimistic spirit, and staying connected with family and friends. These are the strong foundations for lasting health. In this way, old age is no longer a burden, but a peaceful journey where each day carries meaning. That is the true goal of healthcare. Not endless tests, but a life lived calmly, joyfully, and fully. Thank you so much for staying with Health 247 until the very end. Your support and attention are what inspire us to continue bringing you meaningful and useful content. If you found this video helpful, please give it a like, share it with your loved ones, and don't forget to subscribe to Health 247 so you won't miss our newest videos. We wish you health, peace, and happiness with your family.